everyone. This is Food Policy Council's Accessibility, Sustainability, and Equity with me, Ishani Bakshi from Edison High School, and today is June 25th, 2023. So hi, my name is Ishani Bakshi, and I'm incredibly excited to be part of the 2023 Global Health Leaders Conference. A bit about me, I'm a rising sophomore from Edison, New Jersey, specifically a member of the Edison High STEM program. At school, I participate in Model UN, National History Day, the Eagles Eye newspaper. Outside of school, I intern at the UPenn Bauer Lab, learn more about epidemiology and statistics from the Tufts Leveraging Environmental Epidemiology for Equity Lab. I'm the founder of the Women's Alliance STEM Humanities, which merges together those two topics through a combination of workshops and mentorships. And most importantly, over the past year, I conducted research under NJIT professor Maury Cohen with Ayushi Shah on food policy councils and assessing the food-related needs of Middlesex County, New Jersey. Okay, so a bit of background information. What is a food policy council? An FPC is an organization that brings together stakeholders from across the 5 food sectors, which being production, transformation, distribution and retail, food access and consumption, and waste management. And they all come together to assess the food system, increase communication, write policy, and advocate for food and environmental justice. They can be grassroots, local, regional, have varying amounts of government collaboration. Typically, they are divided into different work groups that focus on different issues or different parts of the food system, and they love to encourage collaboration between all these different fields. The first ever FPC was in Knoxville, Knox County, Tennessee, and was formed in response to the 1981 welfare rollback. So think food stamps were getting rollback, school breakfast, all that stuff. And they try to get people who were either in the government, food industry, or had high community involvement, which is similar to what occurs today. And their main goals was to create a thorough administration and interagency task force to keep up the communication networking, to assess distribution patterns, and to fix them to make them more equitable, and to kind of bring in food justice into economic development. So in general, food policy councils are a great public health tool because they increase access to resources and nutrition education, which combats the rising food deserts, which also impact the health of marginalized and vulnerable populations even more than the rest. FPCs also promote economic, health, and environmental sustainability, and they have been proven to enhance the health outcomes of marginalized populations. Specifically regarding our work at NJIT, for the past year, we conducted a review of the literature surrounding food policy councils and specifically analyzed NJ case studies, and currently we're still working on understanding more about what a possible food alliance in Middlesex County would look like. Okay, so first point, food deserts. What are they? They're a community with poor access to healthy and affordable nutrition. Healthline reports in 2016, compared with the national average, Black households were 2 times likelier to be food insecure, while Hispanic households had a greater prevalence of food insecurity. Predominantly, Black and Hispanic communities have fewer supermarkets and local food markets than white neighborhoods. This basically means that Black and Hispanic households have less access to nutrition, which makes them more likely to have chronic diseases that come from lack of nutrition. Think cardiovascular disease, obesity, diabetes, etc. But food policy councils are there to combat this disproportionate dispensing of nutrition hotspots. And they do this by fixing transportation routes to make supermarkets more accessible. They work with agriculture and farmers markets to bring the resources to these communities. They work with school breakfasts to make nutrition more accessible too. And for an instance is New Jersey Food Council, which isn't specifically a food policy council, but they did something similar by having NJ grocers be able to represent their voices to big retail. And talking about how food is a really big problem even in my community. In Middlesex County, the McFoods pantries, only 37% have weekend hours and 46% are only allow people to get food once a month. Which creates this temporal food desert. So moving on, food policy councils also play a key role in environmental justice and sustainability. They do so by diversifying supply chains, combating the urban heat island, and protecting crop varieties. So to elaborate, for instance, in the Denver, Colorado, and the Milwaukee, Wisconsin food policy councils have used unused space in their cities to implement chicken coops and beehives. And the Chicago Food Policy Council works with a Growing Power Urban Agriculture Initiative and have also restructured their Department of Environment's composting program to legalize intercity composting. Both of these examples show food policy councils bringing nutrition to the community's doorsteps, which makes them more accessible and further prevents various public health epidemics such as obesity and diabetes taking a chokehold on the community. In the Atlanta, Georgia Food Policy Council, they work greatly to bring in more urban greenery, which combats any climate-related health effects, such as health effects that come from extreme heat. Last but not least, speaking more on the NG side of things, which is what I researched, the NG Department of Office of Brownfield Reuse has already working with Trenton, Camden, Perth, Amboy, and Bayonne to reuse brownfield, which are fuels that have been contaminated by industry use. While this is not the action of the Food Policy Council, it's something very in line with the mission and shows how states already have systems in place that can be further assisted by food policy councils. Then we have better health outcomes for marginalized communities through an emphasis on food justice and policy, which food policy councils can bring. So first of all, in a study conducted by Samantha J. Lang, among municipalities with FPCs, nearly all reported having at least one policy support for healthy food access, compared to 84.9% of municipalities without. Similarly, and more importantly, municipalities with FPCs have significantly higher odds of having any support for food stores, farmers markets, transportation relating, or for healthy foods, and objectives in community planning documents. So what this basically means is that when there's food policy council in an area, they're more likely to identify the areas that need the most help, which is often concentrated in marginalized groups, and they can focus their energy and output into ensuring that they have better health outcomes. For example, in the Passaic County Food Policy Council, they're expanding farmers markets and breakfast in the city of Patterson, NJ, which is one of the most distressed neighborhoods and has a high concentrations of minorities who don't have access and socioeconomically stressed people who don't have access to nutrition. And similarly, the Oktibah Food Policy Council, they're incredibly focused on food justice and more resources for Black farmers and etc. to empower a group that has not been empowered in the food industry for a while. In general, food policy councils really strive to have good communication so that the needs of the community are being voiced and assisted. Focus on nutrition education. For example, the New Brunswick Community Alliance works with Habitat for Humanity to teach young families on how to cook nutritiously. They focus on bringing culturally relevant foods to the top so people can connect with their culture while also being healthy, and promote great programs like SNAP. So regarding our own work and what our further goals are, we hope to further assess Middlesex County's needs, establish more communication inside the county, and streamline the Food Policy Council creation or alliance process for others who wish to do the same. So in conclusion, food policy councils are made up of diverse stakeholders and methods, and they're a great public health tool because they address food deserts. They are key to sustainability, and they improve the health of marginalized groups. But at the end of the day, it all boils down to your choice. It is your choice to see how you want to participate in such a community, or if you want to lead such an initiative in your area. And it's your choice to see how you can change the lives of those around you. In conclusion, these are my references, and I want to acknowledge Professor Mori Cohen and Yushi Shah for really introducing me to this research in this whole world of food policy councils, and it's helping me in my professional career so much. And thank you for listening. And if you have any questions, feel free to email me at this address or contact me over at LinkedIn. Thank you.